Hello, everyone. So I'd like to welcome you to today's webinar. This is the inaugural webinar of the Bridge DISA Center for Data Science and Artificial Intelligence. I am Anindar Sundar Chakraborty from the economics area. I'm also a chairperson of this center. And we are very glad to have, and it's a great pleasure and honor for us to welcome Professor Sudha Ram from University of Arizona. And this is, we are really, grateful to you for, coming over and giving the talk, at least currently online. Later on, I hope that you will visit us also physically, but she will be giving the inaugural talk around data science and the grand challenges regarding its intersections with information systems, and potentially more will come up during the talk. We are also joined by Professor Adrija Mojumdar, who will host the talk. And without further ado, I would request Professor Mojumdar to carry on the discussion with Sudha. And we are all looking forward to learn more about, the intersection of data science and AI and the other grand challenges that you have. Thank you very much. I'll turn it over to Adrija.
Thank you so much, Professor Olindo. Indeed, very good evening to everyone. You are very warm welcome. And we are very pleased to have with us today Dr. Sudha Rao. She's going to be the inaugural speaker from the Bridge DISA Center for Data Science and Artificial Intelligence Seminar Series. Dr. Ram needs no introduction, but I would like to highlight some of her accomplishments. She is currently the Anheuser-Busch Endowed Professor of MIS, Entrepreneurship and Innovation in the Eller College of Management, the University of Arizona. She has joined faculty appointments as Professor of Computer Science, member of Biofile Institute and Institute for Environment. She is also the director of the Insight Center for Business Intelligence and Analytics at the University of Arizona. Dr. Ram received her PhD from University of Illinois at Urbana-Champaign in 1985, and she also holds PGD from IIMA Calcutta. Her research is in the areas of big data analytics, business intelligence, and large-scale network science. She has published more than 250 research articles in top-tier journals, refereed journals, conferences, and book chapters. She has received more than $17 million research funding from both corporate sources and government agencies, including organizations such as IBM, Intel Corporation, SAP, and so on. She serves as a senior editor for Information Systems Research and is currently a senior editor of JAIS, Journal of AIS, and also on the editorial board of many other leading IS journals. She was a co-editor-in-chief of the Journal of Data Semantics and currently is a founding editor for Journal of Business Analytics. She is an AIS fellow and a recipient of several other prestigious teaching and research awards. Most recently, she received the Peter Chen Award for Conceptual Modeling and the Distinguished Fellow Award from the Information Systems Society. Thank you once again, Dr. Ram, for accepting our invitation. I know it's early morning for you, but we are very happy to have you here today. For the participants, you may please post your questions on the chat and I'll be very happy to take them up with Dr. Ram. We have a presentation of around 30 to 40 minutes, and after that we have also a dedicated question and answer session. So you may post your questions at that point as well. Yes, and without further ado, I would just request Professor Ram to take over.
Thank you very much, Onindo and Odrija, for the beautiful introduction and for the very warm welcome. I am simply thrilled to be at the IIM Ahmedabad campus virtually. I also wish I could be there in person, but hopefully that'll happen soon with us managing the world managing the pandemic so well. I am very happy to be there to talk about how can we address grand challenges And since my area of research is information systems and computer science, and I also work on a bunch of interdisciplinary projects, that'll be the perspective that I will bring to the table. And most relevant to your center, by the way, congratulations on setting up this new center. And I wish you a lot of good luck. It's a wonderful time to be doing research in this area. So that's the theme of my talk today, is how do we address grand challenges in research and how do we make an impact? And I'll give you some examples. So by way of background, as Audrija mentioned, I run a research center called Insight. It's a center for business intelligence and analytics, and our focus is on developing machine learning methods coupled with network science or large-scale graph methods. Most of all, we address the holy grail of machine learning, which is prediction in the future in a timely manner, using spatiotemporal data or big data, so that we can take some actions or do interventions. And our techniques are also now being extended to AI interpretability and explainability, because that has become very important these days with the development of advanced machine learning methods, which are a number of which are black boxes. But most of all, I want to emphasize that our focus for the last several years has been on addressing interesting questions and problems that have a social impact. And so examples of those are healthcare, obviously, because that impacts each of us directly. Building smart communities and smart cities. And something that's very near and dear to my heart is education, because I've been a professor here for so many years, applying some of these to develop smart campus management techniques. And so today I'll be giving, this is my agenda for today. I'll be talking about what high impact research means, how to sort of expand our definition of impact, and how do we actually address grand challenges. And then I'll give you examples of 3 or 4 examples of my own research that have addressed grand challenges, are continuing to address them, and how we can transform our field to greater heights. So we live in a world of what's called the 4th industrial revolution. It's a world that's fueled by advances in technology, in data, in all kinds of devices, the Internet of Things, sensors, and the economics of all of these are becoming so, the cost is going down so much that we're able to put sensors on almost everything, which is generating a lot of data. Who would have thought we would have self-driving cars and self-driving trucks? That's all based on the Internet of Things. We have social media, of course. We have wearables. If you're like me, you're probably wearing a Fitbit that tracks your heart rate, your sleep patterns, the number of steps, and in some cases, it measures your heart, your arrhythmia in your heart, things like that. So this confluence of data that's being generated by all of us, every object and person in this world today is leaving massive digital footprints. And when you put all these digital footprints together, that provides you with a tremendous potential to actually leverage with AI technologies. So there's been a paradigm shift in terms of the amount of data, the types of data, and the fact that we get very granular data from almost everything in the world. This is coupled with a paradigm shift in AI technologies. What I mean by that is back in the late 80s and early 90s, what was popular was symbolic logic. Of course, AI started in the 1950s with symbolic logic being the dominant paradigm, where we had operators and rules and expert systems, but those turned out to be very brittle. And now what we have are sub-symbolic systems, which are modeled after the brain, where you have neurons that communicate with each other you have to determine the weight of the communication, the weights of the neurons, and you have layers of these neurons put together making decisions, which is how the brain works. And that's being mimicked in our new methods in deep learning, like convolutional neural nets, recurrent neural nets, the LSTMs, and so on. But unfortunately, those methods are black boxes. They are very good, they're very accurate, but they're black boxes. And so to improve them, we need mechanisms to experiment, open them up, and that's where AI explainability comes in. So there's this paradigm shift in our world in terms of data and in terms of AI technologies. And so I think our field, the information systems field, coupled with other disciplines in the business school or in computer science, have the ability now to actually focus on a very different kind of research. And what we now have is an opportunity to do a paradigm shift even in our own fields. And what that means is now we can actually focus on grand challenges facing society. So whether it's policy making, whether it's addressing chronic conditions or transportation or any of those other things, biology, biomedical innovations, this is an opportunity for us to use data science. And we want to change our thinking from sort of the behavioral way of doing things, which is starting with a theory and then developing a study and then testing some hypotheses. Although that's very valuable, I think we now have an opportunity to sort of not necessarily start with theories or create theories in general. And so avoiding this fixation on theory is a big opportunity for us. Don't get me wrong, theories are useful, they are very important, but we don't have to be fixated on them. And so the information systems field can actually lead with high impact research. So what I'm going to do is actually start with what I mean by high impact research. This is not my definition, it's a definition that I have adapted, which says high impact research is an effect on change or benefit to the economy, society, culture, public policy or services, health, the environment, or quality of life beyond academia. Traditionally, we all believe citations are important in our own field, and that is important. But I think if we have now the opportunity using data sciences and addressing grand challenges to make a difference with our academic research to the wider world. And it goes beyond citations in one's own academic field. It goes beyond working with people in one's own academic field to actually collaborating on very large multidisciplinary projects. And so I will talk a little bit more about it towards the end of my talk when I lay out some steps on how we can actually achieve this. So if we all believe that we want to go forward with high impact research, I'll use some examples. I have been at the University of Arizona now for 35 years, and this has been home. And some things I've learned from here are the big science way. The University of Arizona is a big science school. Even the business school has been a big science school, especially the information systems department. We have set up programmatic, comprehensive research programs with big questions and grand challenges. And our measures of high impact research are not just citations, although those are important. They are in terms of grants, sponsored research, patents, technology transfer, startups, industry partnerships, PhD dissertations, publications in many different journals beyond one's own academic discipline. So if you see my own resume, you'll see that I've published in journals and conferences beyond the information systems field, because I do believe that innovations, whether it's in research or in terms of new products and services, happens at the boundaries of disciplines. And when you kind of combine learning from different disciplines, that's where the most interesting things and discoveries happen. So as an example, at Arizona, we have a number of people who worked on very many different types of grand challenges, whether it relates to cybersecurity, detecting criminal activities, looking at building avatars to support detection of deception. My own research has resulted in collaboration with biologists to design robust cyber infrastructure for plant sciences and extending that to other types of sciences. We had a very large funded grant from NSF called the iPlant Collaborative, of which I was one of the co-PIs. My work has been on automatically connecting heterogeneous islands of data using machine learning methods to discover and connect data that are similar and to see relationships. And that's how my research in machine learning got started. And of course, everybody knows about the collaborative systems and group systems research that came out of Arizona. So we have a bunch of different types of research programs which have been deliberately designed in a programmatic manner. And so what I'm doing is advocating that, that's how you sort of build, you have an opportunity to build research programs. So let me walk through several examples of research that deal with grand challenges. While I won't be able to go into details of everything, I think I can present enough to sort of explain how research like this can be set up and executed successfully and what the end result is. So the first area based on research from my center is on chronic disease management and prevention. We all know that one of the biggest challenges in facing healthcare is chronic conditions. There are more than 100 types of chronic conditions, of which many of them are, we are familiar with many of them: diabetes, cardiac problems, asthma, respiratory conditions, things like that. Chronic conditions are the leading cause of hospitalization, mortality, long-term disability, and they account for more than 80% of healthcare costs. And often we know that these chronic conditions can be managed if they are predicted well in advance. Treatments, personalized mechanisms can be put in place to treat people, to improve the quality of health, to reduce the costs, and also to prevent deaths. And of course, personalized medicine is now on the rise because of the availability of different types of data and technologies. So this is a big area. This is a huge grand challenge, is how do you predict, prevent, or manage chronic conditions? This is one of the biggest grand challenges. So with respect to this grand challenge in healthcare, we've seen that data science can actually be used very, very productively in this area. The impact of data science in healthcare has been shown in terms of containing costs, in terms of moving towards evidence-based or personalized medicine and need for customized chronic disease management. But the challenge is to actually define the problem in a way that you can actually identify the right data and determine how best to develop techniques and what techniques to use. And often what you're doing is you're repurposing data. So it's not data that's specifically coming only from electronic health records or from the episodic kind of health records that you find from patients visiting doctors, but from many other sources. In the US, we also have a lot of privacy restrictions. We have an act called HIPAA, which is our Healthcare Privacy Act. And that is actually is a very significant barrier to being able to repurpose data. But when you talk to physicians, they're very interested in being able to connect different types of data about an individual patient so the right treatment mechanisms can be designed. And so using big data for chronic disease prediction and management is now one of the fastest growing areas in healthcare analytics. So I'm going to give you some examples from here. In my own center, over the last several years, we've been developing many different models to address different kinds of healthcare chronic conditions. One of our biggest focus has been on respiratory conditions, where we've developed robust models to predict asthma-related ED visits. And I'll go into deeper information about this. We've also tried to understand risk factors for asthma exacerbation in collaboration with one of our major healthcare systems. My most recent paper has been on targeting a very important problem, which is when a patient comes in to an emergency room. We have very limited history about the patient. In fact, we typically have only the diagnoses that are made at the time of admission. And we've developed some graph-based methods using a combination of graph convolutional methods as well as node embedding methods, coupled with collaborative filtering to diagnose the post-admission conditions accurately so that those can be targeted so that patient mortality, so patient deaths are prevented. And then we're working on a bunch of studies related to e-cigarettes. So today I'm going to talk a little bit more about these first two before moving on to other examples. So let's look at this models to predict asthma-related ED visits. A few years ago, I was in a panel with the CEO of Parkland Hospital, Ruben Amarisingham. He also heads the Parkland Foundation. And one of the talks I was giving at the panel was about how healthcare can be impacted using AI and big data. And so his question to me was, how can you help our hospital with big data? That's the typical kind of question I get asked. And my answer to that is always, it depends on what your problems are, right? There's no one answer to this problem. And so he invited me to give a talk at their hospital. And as I went there, we started to talk to a bunch of physicians. We had physicians from almost every specialty, kidney, heart, etc. And talking to them, certain problems started to surface. And one of them was the number of people and the types of people coming to an emergency room. When we sifted through the healthcare records with IRB permissions, we found that a big pattern of people coming to the ER or the emergency department, the ED, is people with respiratory conditions, and there's no pattern to when these people will show up. As a result, some of the ED physicians said that they had a struggle to deal with onslaught of asthma exacerbation patients. And often they didn't have the right equipment, they didn't have the right physicians, they didn't have the right nurses to deal with such patients. It sort of sounds like what happened when COVID-19 hit and the hospitals started to get overcrowded, right? But this is with a chronic condition. And so the problem was that if they looked at the healthcare records, really that was of no use in terms of predicting exactly how many people would show up. And so they said it would be very useful if we had some way of getting signals to predict how many people would show up in an ED with specific chronic conditions like asthma. And if we could do that prediction about 72 hours in advance, then at least we can get our hospital ready with the right kinds of physicians on call, with the right kinds of equipment. We could warn nearby hospitals and so on. So we said, let's start narrowing the problem from all kinds of chronic conditions to asthma. And once we did that, we looked at the medical literature, and the medical literature is rife with all kinds of studies about what are the causes for asthma exacerbation, including environmental quality, changes in temperature, levels of humidity, drastic changes in the amount of rainfall, things like that. But the jury is still out on what really causes exacerbation, right? So we thought about, what sorts of predictions would be useful. Would it be a personalized prediction to say which person is likely to show up in the ED 72 hours in advance, or could we do a population level prediction, right? And in this case, in working with the physicians, we determined that for the ED in this hospital, what would be most useful would be a population level prediction. That is predicting how many people will show up. And so rather than doing an individual level prediction using electronic medical records, which has been done in the past, but that prediction has a time frame of about 6 months, and that's not very valuable for managing an ED. We wanted a more immediate prediction. So we thought about how can we do that? And when you just try to do a prediction, even with a very sophisticated machine learning model with just electronic health records, it's not very helpful. It's about 50% accurate, which means if you're predicting for 100 days, 50 of those days would be accurate, and surely we can do better than that. So this is an example of how you start with a very large problem and start to narrow it down and then try to develop some solutions. So when we did that, we said, let's think about what data we can collect, external signals we can collect to help us identify and predict things accurately, right? And so we said, let's turn to social media. Let's turn to Google searches. Social media, because people post all kinds of things on social media. Of course, certain types of social media are not accessible. You really can't collect data from Facebook. You can collect data from blogs, certain kinds of medical discussion forums, if you get the permission. So we decided to turn to Twitter. And when I first proposed the idea of collecting signals about health behavior from Twitter, some of the physicians were incredulous. They said, really? I mean, is that even possible? And so we said, let's try it. There's no guarantee that we'll find anything. But when we did, we started to use all kinds of asthma-related keywords. And you see here, there are people talk about asthma attacks. And of course, on the right side, there's a lot of noise. People saying things like, my chemistry exam was so tough, I started to have an asthma attack. Or I sat next to this guy in the bus who looked like Justin Bieber, and I thought I was going to have an asthma attack. So, those kinds of posts are really not helpful. They actually detract from the accuracy of a prediction model. So you can collect data from social media, and we developed some artificial neural net methods based on natural language processing to filter out the true asthma tweets from the fake asthma tweets. And of course, we collected a whole bunch of data from Twitter. Publicly available tweets can be easily collected through the Twitter APIs. And here you see, you can even extract the timestamp and the location for a lot of these tweets. And so here you see a map for just about half an hour of tweets related to asthma, right? With just the locations in the tweets. We also use some innovative methods to extract locations when their location was not turned on, but there were maybe keywords in the tweet itself or in the profile. These are labeled by the keywords we used. We had about 50 different keywords like nebulizer, names of asthma drugs, things like that. And then the next thing we decided was tweets are not enough. We also, because the medical literature says that environmental quality affects asthma exacerbation, there are publicly available sources of environmental quality data from the EPA. The Environmental Pollution Protection Agency actually has hundreds and thousands of sensors in every part of the US. So using the coordinates of the hospital, in this case, the Parkland Hospital, and the areas that this hospital services, we collected air quality data from the EPA data sets. There is a problem with these data sets as well, and that is that often sometimes the sensors go down, so you have to develop interpolation techniques or extrapolation techniques to fill in the gaps. Sometimes certain types, some of the measures for air quality, like sulfur dioxide, might be at 5-minute intervals. For PM 2.5 might be at 1-minute intervals. So if you're going to build these machine learning models, you have to make sure you at least, normalize them all to the same level. So there are, besides the noise, there is ways of data preparation you have to do. And then there's the choice of the machine learning model that you have to use. So using all of this data, we gathered data sets on a lot of different pollutants in the air. And you can see I've listed out these pollutants, PM 2.5, PM 10, etc. So based on this, and also somebody suggested, since Google was very successful in their Google Flu Trends tool, where they use keywords, and they used that to predict how fast flu was spreading and how far it was spreading in advance of the spread. They had worked with CDC, the Center for Disease Control, so that CDC could rush vaccine to places that were predicted to have the onslaught of this flu. And so we said we can ask Google to provide us with the search data, and they do provide you with aggregated search data with certain keywords in certain locations. Of course, the granularity of the data is not very good because it doesn't give you for individual zip codes. Nevertheless, we thought we could still try it. So we used that, and we used some machine learning methods to predict number of ED visits per day. And this was 72 hours in advance. We tried it 48 hours in advance. We tried it 2 weeks in advance. The most accurate was 72 hours in advance with about 80% accuracy, which means we can predict 8 of the 10 days. And we also developed the attention mechanism along with our deep learning networks and found that the number of asthma tweets, the levels of carbon monoxide, nitrogen dioxide, and PM 2.5 were most predictive of this number. And that adds to the medical literature as well, where the jury is still out on what actually causes asthma exacerbation, because individuals are affected in different ways. So this is a grand challenge. We've actually found some feasible solutions for it. And now we've extended this from one hospital to 100 hospitals in the US in different areas. Can we extend it to every hospital? Probably not, because a lot of the hospitals are in very rural areas with no internet connection. You probably don't see tweets, social media data. You have sensors, but they are very sporadically spaced in terms of the pollutants and the data streams that come out of the EPA. But nevertheless, we've expanded it. We started with a 3-month problem, expanded it to a year, and we were able to verify and validate our models. And now the hospitals are actually using it for stakeholder notification. So if an area or a hospital is expected to have very high number of people coming in on a certain day, they can issue notifications to schools. We're building an app which can be used by people to get notifications to make sure your medication is refilled. They don't run out of medications, or if they plan to run outside, to stay inside on those particular days. The hospital EDs are now using our models to predict asthma visits and do their staffing decisions, which used to be 3 weeks in advance, which are now dynamically changed based on the predictions. So this is an example, and this is the app we're talking about targeted patient interventions. If we can predict for certain zip codes, how many people would show up in the ED. So here we've shown feasibility of doing these predictions by repurposing spatiotemporal data from diverse sources. And this is for a non-communicable disease. It's different from flu, different from COVID, with the specific focus on a chronic condition. The question then comes up, can we do this for other chronic conditions like diabetes or cardiac problems or obesity? We think we can do it for diabetes. We are trying to do it for diabetes. We can do it for obesity, probably not for cardiac problems. Interesting thing is, people were tweeting about the fact that their child had an asthma attack and that they needed to go pick up the child from school. Before they got into their car, they would tweet about it. Not so good for the children, good for researchers like us. Cardiac problems, that's unlikely to happen. But can we predict cardiac problems with other sources? Probably, if we had text messages being exchanged between family members, if they had wearables. And so that is something that we have to think about, and we are looking at that. The thing with getting text messages and wearable data is you need to jump through a lot of IRB hoops to be able to collect that data. So again, there are always some challenges in terms of what signals you can have, what methods you can develop. So that's one example. I'm going to walk through a few other examples very quickly to give you a sense for other types of questions that can be answered. The second question, and this is a paper we published in MIS Quarterly last year, we decided to work with biomedical researchers at the University of Arizona and the Banner Health System here, because one of the types of studies that people do in the medical field is cohort-based studies, which is to understand triggers and risk factors for certain chronic conditions. And here again, taking asthma as the extension from the previous study, there's many different cohort-based studies that have been done. But when you think about respiratory conditions like asthma, there's a whole bunch of different types of triggers. There's demographic triggers, biological triggers, there's environmental related, there's behavioral, if you smoke, for example, or if you live in an area where there's a lot of pollution, there's social and psychological triggers as well. And so it's not really clear, what causes asthma exacerbation for different people. So in this study, what we decided to do was, instead of just doing a small cohort-based study, we said, can we enlarge these cohort-based studies using retrospective data from various sources? And so this is where we said, again, let's gather data about asthma patients from social media, and then let's collect socioeconomic data from other sources, environmental data, and let's design a study that'll be a substitute or complement for traditional cohort-based studies. It's a new way to collect background and demographic information. You don't have to put a cohort together. You can actually collect this cohort from all the data that's out there. And moreover, we can develop machine learning methods that try to look at the interconnection or interrelationship between various triggers and risk factors. Typically, when these cohort-based studies are done, they look at one trigger. They don't look at these interconnections. But with machine learning, you can actually try to look at the interrelationships and their relative importance. And so we wanted to go beyond the current mainstream approaches, which are mainly based on survey-based methods. Again, they focus on one or two types of triggers, but typically don't look at their interconnections. Sometimes the targeted population in the study is very small, and you have to follow them over a long period of time. And again, that's very expensive. So, and you focus on very limited factors. So we said, well, there are lots of limitations, but we live in the fourth IR. Why not try a totally different approach to tackle this grand challenge, whether it's asthma or any other chronic condition? So this is what we've done. And I will give credit to one of my doctoral students, Wenli Zhang, who actually put the study together. She's now employed in Iowa as an assistant professor. The idea was to develop a framework to identify asthma patients on various types of social media platforms, whether they're blogs or Twitter or medical forums, derive their demographic characteristics using convolutional neural nets and also from various types of information they post about themselves, and then collect a whole slew of different types of data from social media, environmental census, socioeconomic data, as well as outpatient illness surveillance data sets, which are available. And we link them all together. And then we developed some sequential pattern mining techniques coupled with random forest to identify triggers and risk factors in different locations, as well as different time zones. So this was actually very successful because we worked with our medical asthma professionals at the University of Arizona, and we were able to identify demographic as well as socioeconomic risk factors coupled with environmental factors and very precise interpretations to say what would actually cause asthma exacerbation in the Southwest, in the Native American community versus the Hispanic community in Florida, et cetera. And so this needed a lot of interaction with the domain experts. It also needed collection and resolving the heterogeneity in the various data sources. So this was a very complex problem. It took about 3 years, but we were able to get good results that also is very useful for our physicians who work in the Banner Medical Health System. The next example I'm going to give you is related to education. This is very near and dear to my heart, having been an educator and researcher for many years. When I first set up our research center, the University of Arizona came to me and said, what can you do to help us? We are a state university and our funding sources are going down. Can you help us with that? I said, that doesn't need prediction modeling. We know funding is going to go down. Let's tackle other problems that a university has. So one of the biggest challenges in a public university in the US is student retention. This has been a challenge for the last 50, 60 years. A lot of people have done lots of studies from a behavioral perspective on what causes students to drop out using surveys, right? In fact, now people are using even machine learning methods to look at students' academic records, their grades, their performance, and do a prediction. The problem with all these methods is that they are not far enough. The prediction is not in a timely manner. When you talk to students who drop out and you do exit interviews with them, they will tell you that they decide to drop out of a university in about halfway through their first semester. So our semesters are about 16 weeks long. Students make this decision to drop out about 10 to 12 weeks in the first semester, about 2/3 of the way. And so unless you can predict and catch them before they make that decision, they're gone, right? They've made up their mind. So this student retention prediction is a very, very difficult problem. It's a grand challenge. There's been lots of efforts put into it. Student retention rates are a key outcome measurement for public universities. It has a huge financial impact in terms of how much the government, the state government can appropriate. And so very little dent has been made in this problem. Surveys are not useful because students who drop out tend not to respond to surveys. Surveys have very low return rate. They're not cost effective. And if you don't identify them early, as I said, they're gone. So we said, how can we design methods that leverage AI and big data to address this problem in a new and different way? So what we did was we said, let's look at some theories. So this is one case where theories can actually help us design the machine learning models and the features that go into the machine learning models. Typically with machine learning, you just throw a bunch of variables, design a model, and then see which ones are important. But here theories come in very useful. And turns out that there are two theories that sort of percolate to the top. One theory says that students that don't establish good social relationships on campus, tend to drop out. And the other theory says people who don't establish a regular routine and get settled into campus tend to drop out. So the question then becomes, how do you get these signals early enough, right? Well, somebody said we could embed a chip in the student and just track them. That's a huge privacy invasion. We can't do that, right? So we said, what's the next best thing you can do? And also, you don't want to use the grade point average because that comes at the end of the semester. Often grades are not really indicative of their decision to drop out at all, right? Because many of the students who drop out actually have very good grades. So the question then becomes, what are some mechanisms to be able to get signals and to do this prediction more accurately? So we decided we will use some other sources and repurpose them, which is one is we have something called a smart card that people use on campus. Every student is issued a smart card and they use it for various services on campus, whether it's using the fitness center, going into labs, using the library, going into classrooms, buying things, having lunch with each other, things like that, right? Almost like embedding a chip, but not quite, right? It's used in about 500 different places on campus. Then we also said we could use Wi-Fi logs, because every student uses a phone, a laptop, various devices, and you can actually track their movements and behavior through the spatiotemporal data generated through Wi-Fi logs. And we don't want to use their grade point averages at all, or their grades, because grades don't come till the 18th or 20th week of the semester. So what we did was we collected data from, of course, their demographics and all of that stuff from the institutional student data set, but we collected the smart card transaction data set. At the time we started this project, we couldn't get access to the Wi-Fi data because it was managed by an outside company and they couldn't give us the data back to us. There were some barriers. Instead, we just decided to go with the smart card transactions. And using these theories, we actually said, let's try to glean social interaction and campus integration or regularity of routine features from this data. So we extracted this latent information by building networks using the smart card data. So if students happen to show up in the same location consistently at the same time over a period of time, we built these networks, and using these networks, we extracted measures of how many people a student interacts with on a regular basis. What is the size of their social circle? What is the stability of their social circle? We even developed an algorithm based on natural language processing to look at the sequence of check-ins at different places to see if two strings of check-in are identical over the week, or if they're identical, to get a sense of their regularity of routine. And so these are all published in different papers. So we learned their latent behavioral patterns using machine learning methods. These are examples of networks. On the left side, you see the behavior of students in economics. On the right side, you see the behavior of students in the business school. And so you can start to see different patterns of interaction. We did a prediction and we found that our network, the social integration measures, which are highlighted in red here, are the ones that are most predictive of students dropping out. And we're able to do this prediction 12 weeks into the first semester without using any of their academic indicators at all. And we found that we could catch 90%. So our recall rate for prediction was 90%, which means of the 100 students who dropped out at the end of the first semester, we were able to catch about 90 of them. So now the university is using these results. This is a personalized prediction as opposed to the population level prediction that I talked about in the asthma case. So now we're able to actually do interventions with these students. We're able to figure out which of these measures or features are most predictive. And the Student Retention Office is using these results to do interventions to keep the students in school. So I'm going to skip over the last example, but very quickly, I'm going to say that we've now developed a relationship in smart cities with certain cities in Brazil. We worked with them to redesign their transportation system using, again, the smart card and spatiotemporal data. We've developed a whole slew of methods for understanding human mobility in transportation. That's a big challenge, again, grand challenge. And this is a city in Brazil called Fortaleza, where we worked with the city to design, answer questions based on human mobility patterns on where to put certain bus stops, how to connect their bike share system with the bus transportation system and the metro system, and where to put their big terminals for bus stations, so that safety is preserved and at the same time they're able to cater to a large population. So optimizing resource allocation has become very important. Again, this is based on spatiotemporal data and recurrent neural nets that looks at sequences of movements from people. So this is another grand challenge. Closer to our University of Arizona, when the COVID pandemic started, again, the university approached my center and said, how can you help us manage? So one of the things we did to help in contact tracing and crowd management was to leverage the Wi-Fi data. And we looked at crowds at different parts of the campuses so that we could provide some notifications about which parts of the campuses needed crowd dissipation, which parts needed extra cleaning. We even helped develop mechanisms to look at movement in campus from the quarantine dorms to other areas so that extra security could be put in place. And so, and also for contact tracing, when someone is identified or tested positive for COVID, a public health expert calls them and walks them through their movements in the last 14 days. And so we don't often remember where we were yesterday at this time or day before yesterday, let alone last 14 days. So we've built a dashboard with the Wi-Fi data to help them understand their movement so they can actually recall their movements and help in contact tracing. So all of these can help answer questions like, how well are the quarantine dorm policies working? Where do we put the self-test kits looking at traffic patterns? Where should pop-up testing sites be located? And now we're developing an app to predict crowds so people can plan their movements on campus. They can decide when they want to go get their lunch or when they want to be in a certain lab, things like that. So based on all this, I kind of want to now come back to that original question I started with, which is this whole idea of grand challenges, right? So I've given you lots of examples of addressing grand challenges. And so the first point I want to make is theory development or a priori theory is not a requirement, nor is it a strict prerequisite. It helps in some cases, but you don't always have to think about that. So that's a shift in the information systems field. Long-term research is not opportunistic. It's programmatic, it's multidisciplinary. You want to develop partnerships with other domains. For example, we've developed partnerships with medical professionals to understand the domain, with environmental policy makers, with people in the biomedical field, in physics, etc. And so data science is at the core of addressing these grand challenges because there's an opportunity to do that. And most of all, what I want to say is that we don't want, typically I've seen in the IS field, people have a data set and they say, I'm going to mine the heck out of it and create questions. I'm saying, let's reverse that. You start with a grand challenge, start with questions and think about the scientific way, which is what Herbert Simon always talks about. What data can I collect? What signals can I come to bring to bear on this problem? So then I can build a model and answer some questions. And so this last point is starting with a grand challenge as opposed to having a data set that's very convenient and creating questions from it. To me, that's the crux of using data science. So again, I kind of put that in bold because I want to emphasize that. So the calls to action, because you have this center, are, work with journals, help them create a high impact grand challenges track. I'm working with journals to do that. With my own journal, that's one of the challenges we're having. Foster a culture in the business school of getting grants and interdisciplinary collaborations. That means going beyond collaborating with your colleague in marketing or finance or accounting. Go outside the business school and develop collaborations, publish in a diverse set of journals, and have mentoring and support for grant writing. Industry partnerships are very important. My own center over time has developed lots of partnerships, both for funding and for finding interesting problems in many of these areas. When you start a grand challenge project like this, as academic researchers, we need to be able to publish. especially for our young faculty and our PhD students. So plan for research publications and then combine the data science approaches with design science, show something that's practical, but at the same time has methodological implications. And finally, I think we need, as a field, we need to move forward and evaluate research using criteria that go beyond just what this paper does, but what is the intellectual merit and broader impacts on society. This is what National Science Foundation does when they evaluate our proposals, is looking at this broader impacts on society. I have more on this in the paper I've published in MISQ with Paulo. So where do we go from here? This is my last slide. Let's disturb the equilibrium. Let's make ourselves uncomfortable, embrace the data science and design science. I feel like I'm probably preaching to the choir because this is a center on data science. Be open to interdisciplinary work. This is difficult. This is challenging, takes time because you have to learn to speak each other's languages, but there's more in common than you will realize when you start to talk to people outside your field. And starting with the definition of a grand challenge is very important. So we have a very bright future for the IS field and for business schools in general, I think. I'm going to stop here and ask if you have questions. Thank you.
Thank you, Professor Ram. That was a very interesting and impactful talk. In fact, really amazing insights and the challenges you talked about. It's actually challenging the normal way of first getting the data and then thinking what questions we can address, but rather looking at the question first and then, searching for data from different aspects. That was amazing.